UWITV now presents a special COVID-19 Symposium hosted by the Caribbean Public Health Agency CARPHA on March 11, 2020 in Trinidad and Tobago.
So at this point, we want to open up a question and answer session to those in-house, whether it be questions you have on your role, on your approach, on accessing information, or just more general concerns or questions about the spread of the virus and the disease itself. And we're also going to be taking some of our online questions shortly. So first, we'll just start with anybody in the room. Rashad?
Hi, good day. Rashad Khan, Guardian Media again. I'm going to jump out myself a little bit here with the obvious question. Now that the WHO has declared it a pandemic, does this change anything for us regionally or CARPHA's approach or anything like that?
So, yeah, I can start, yeah. So we have been telling countries, when we raise the risk to very high, we have been telling countries that, there is a need to change from preparedness to readiness. So, and that has, if you notice in the last couple of days, the fact that we got a confirmed case from a CARICOM country. So countries are well aware, so now they are moving towards that readiness phase as if they are likely now to deal with a case. So in terms of one of the reasons when you call a pandemic as well, it allows you to free up more resources. It gives a country that right then to be able to get in resources that they normally do not get. So therefore, countries will now have more resources. So for instance, if you notice in last night, the U.S. calls like Broward County, just so it can be as such that they will be able to get more resources to do the work. But it means more enhanced measures, making sure all the things that we have said for the health sector response, ports of entry, prevention and control. And this is a really good time for us, the media, for you all, the media, to keep pushing that.
Okay, so I know you spoke again and reiterated some of the points that Dr. Stephanie made, but does it more specifically, you said it allows countries more flexibility to deal with it, but does it impact CARPHA in any way? Does CARPHA now have any more room for anything?
Well, I would certainly hope so. I hope we get more resources out of this. Yes. One of the things is that, we have a lot of partners, and so it gives us a chance then to speak to our international partners to say, okay, now we need even more resources to be able to help strengthen country capacity. Testing, ports of entry, in-country response. I mean, there's a whole list you can help a country. Yeah.
Doctor, I was struggling with finding the difference between what preparedness means and what readiness means. Somebody said that about a week ago, and I was thinking, my understanding of it is that, well, if you prepared, you're ready. What's the difference?
I think, to be politically correct, you could say preparedness and readiness is the same thing. In the context of an outbreak, there might be very slight connotations that might be different. Preparedness is what you would be doing over the years, the plans that you would be writing, getting your systems in place. Readiness it's like you're going to work tomorrow morning. Today, you start to think about your to-do list for tomorrow. Readiness is when you get up tomorrow morning and put on your clothes and get your car keys in your hand. I think to use a layman's connotation, I think that is more like it for us. So your readiness, it means that I'm ready to go now. Preparedness may take a longer phase, and it may have different aspects to it. So readiness is a part of preparedness, but readiness implies that if something happens now, I can deal with it. So it's like that final stage of preparedness, then, if I may use that word to say. Readiness is that last phase of preparedness when you've put everything in place and now I'm confident that if something comes, I can deal with it. I think that would be a way to explain that. Thank you.
And to add to that, I mean, we were advising countries to be prepared when we did not have any imported cases. So once that changed, they had to move to readiness because, now the risk become greater.
Yeah. And my other question is, how do we try and minimize what I consider to be the natural inclination to panic once this thing has now been described as a pandemic?
We are in your hands where that is concerned. If the media can have consistent and credible information and it is delivered in a framework, you just heard your colleagues in the panel, they were very clear and specific. If it can be delivered in a framework that makes it clear that even though the disease is here, we are working to combat it, then people are not likely to panic. But if coming out of this press briefing, your story is, Dr. St. John said there is, let us know that there's a pandemic. What are we going to do now? You see the difference between Dr. St. John has said that WHO has Dr. St. John has said that WHO has declared a pandemic, and the countries of CARICOM have been working towards a coordinated response. You see the difference there.
What does a pandemic entail?
Yes. And then you start to explain some of the things we've been talking about.
So explain it to us, please.
A pandemic entails that there has been spread of the illness in question. It doesn't have to be COVID. There are other things that spread to all regions of the world and countries, although they have exhibited measures to contain, have not been able to contain it. So it's not just that it is in every country, but in some countries, there is the inability to contain it. So it will keep spreading. Pan means all. Endemic is outbreak.
So my next sentence in writing the piece would be, what do we have to do?
Yes.
Seeing that there is this pandemic.
Yes.
So that's a question to you.
The we is the press, or the we is the general public. So we can start with the general public. Yeah. A pandemic has been declared. These are the things that you have to do to make sure you protect yourself and that you protect others. If you feel you're ill, seek advice, but do not go to work or to school because you could spread it. Make sure you wash your hands frequently and thoroughly, and if you don't have access to soap and water and your hands aren't visibly dirty, you use hand sanitizer. If you're feeling unwell and you have to go out in the public, for example, to go to the same doctor, then you need to wear a surgical mask so you do not spread illness to persons around you. When you go to your private doctor or designated location, you're going to give them the full information, including your travel history, or if your country has declared that there is transmission in the community, you will indicate that you may have come into exposure within your country.
And if your doctor or medical staff do not wash their hands from patient to patient, the patient is then in an inferior position. If he or she feels that the doctor, the medical person is the boss, and therefore he has to abide by what the doctor or the nurse says. What do you tell the doctor on this?
I didn't quite understand what you're saying when you said wash your hands, what you meant.
I am saying that if you go to a medical institution,
yes,
and a doctor is going from patient to patient, and you are at the end of the line or in the middle of the line, and you observe that.
Wash their hands in between.
Yeah, but what do you, yes, they haven't. What do you tell them as a patient?
Even in outside of the situation of a pandemic, you must demand hand hygiene. And this is one of the things that we were preaching before the pandemic. Even when I was Chief Medical Officer in Barbados, we would do audits and we would tell our general public, ensure that your doctor is washing your hands. But I'll tell you something else. When I traveled yesterday, when I was leaving Barbados to return, I noticed that after the ticketing agent at Caribbean Airlines in Barbados was finished with me, he pulled out his hand sanitizer and he used it. And I said, what is this? And he said, the policy has come down. After each transaction, we are to use our hand sanitizer between clients. So if a ticketing agent of Caribbean Airlines can do something like this, the general public and the persons who are going to health facilities, they can demand that that is what is happening with their healthcare provider. It is what the healthcare provider knows that they should do. And the other thing I don't want is putting on a pair of gloves and keeping it till thy kingdom come. Unless you're washing the gloves in between patients or interactions, because you could touch something dirty with those gloves and go to a patient.
From a media, is it on? Yes. Quick point from a media manager's point of view, addressing a very important point raised by Drs. Indar and Fletcher Larte concerning resources. And you actually said, Dr. Fletcher Larte, that the authorities have legal power to demand certain things. So here is what I'm going to throw out. You can, through somebody like Kieran, approach the radio and television stations and all the media and say, this is a pandemic. Something short of an outright demand, we would like airtime, column inches, or whatever it is, to put our message out there to the public unfiltered. And I don't know what the legal position is. Kieran can perhaps fill me in on this. But this is a conversation you could, in my view, and should be having. Now, there are two ways to approach it, and let's look at a television station. You could ask for your own block and have control over the production elements of that block, or you could ask for time within existing news segments, Fane's program, Kamal's program, or whatever, to get your message out there. This is my view of what raising it to pandemic level entails, to have hard conversations. Look, bro, we need some time on your station to do this, to get your message out. And lastly...
No, I want to respond to that one. I like it. But do I have to pay?
No, you shouldn't have to pay, is what I'm saying. It's an emergency situation, and the publishers and broadcasters should accommodate you. Yes, and glossary. I don't think that the majority of the public knows what a pandemic is. I think one feeling of medical professionals in communications is throwing out terms that the public do not understand. And this is where the media, the editors especially, getting the stories, coming at them and reviewing them, have got to work with the reporters and the medical professionals. Break it down, make it simple. done.
Can I jump in here?
Can I please give the advice as president of the TTPBA and understanding the concessions? So one is that I think that what we've done today is we've started the conversation, and there is already a willingness by the media to get the information out to the public. I don't think anybody's disputing that. Secondly, you have to remember that each media entity is segmented to reach specific target audiences. And CARPHA does not want to be in a position where they only touch a few media houses and customize material specific to maybe 10 or 12, but you've left out the other 16 or 17 radio stations, etc. So it is better to have this open line of communication. Thirdly, the Broadcasters Association, in their concession agreements with the Telecom Authority of Trinidad and Tobago, there are two clauses, D32 being one of them, which says that in matters of public interest, the government is allowed up to 2 hours a day free airtime, and it's supposed to be used for national emergency situations. So my approach to you would be to go to the Ministry of Health, because quite honestly, the Ministry of Health has not been utilizing the time for exactly what they should be utilizing it for, which is something like this. And the ministry that is now charged with coordinating the public interest material from all ministries in Trinidad and Tobago, we have been told is now Ministry of Communications. Minister Donna Cox had a meeting with the TTPB just a few weeks ago, and we are looking at how we could collaborate and cooperate more. So my advice to CARPHA would be to talk to the Ministry of Health and the Ministry of Communication, and then they can help us with the creation of some of the material also.
So advice, thank you very much for that. What is it, clause B32? D32, that's my new call number, D32.
Wendell Seaman again. First, let me thank CARPHA for this invitation to come to this very informative session here this morning, and Carl and Curtin in particular. The Power Breakfast Show, which is probably the most listened to show on radio, Power 102 FM. We have had the pleasure of interviewing the Minister of Health on numerous occasions since this virus started. We have also interviewed the Chief Medical Officer of Health, that is Dr. Roshan Parashram. Yeah. And we have also had a vet, I think it's Dr. Ora, coming on our program also to talk about that link between the bats and so on. So I want to piggyback on my colleagues who preempted what I wanted to say, and also on Natalie Legor, that CARPHA needs to come now to the radio stations and get their message across. I had this conversation, of course, with Ms. Curtin before that. I hope after today that CARPHA will make themselves available, because people politicize other people when they come. CARPHA, as an independent body, will probably be the best person now to disseminate the information that you would have done so very expertly today. So I'm hoping that on the Power Breakfast Show, again, which I said is the most listened to show on radio, that the invitation is open. Ms. Curtin Carla knows how to contact me. The invitation is open to have you ladies, anybody, to come from tomorrow morning. We on 6 to 9. We are at 88 to 90 Abercrombie Street in Port of Spain.
Okay.
But
I just wanted to correct.
Shameless plug-in, but thank you very much for the offer.
Sorry, Doctor, I just wanted to make a correction. It's D30 and 31. I want to make sure your call numbers are correct,
30
right?
and 31.
D30 and 31.
Yeah.
Thank you.
But Dr. St. John, before you respond, either of you, I just was imagining that the Minister of Health will be on the media tonight, or if not before. Yeah, but
With the pandemic.
yeah, but one thing is that with the declaration of the thing as it stands now, you would think, and so.
And I mean, the thing is, CARPHA has been on with ministry, and I think once we have that clearance, we can do it together or separate, but we need that clearance to make sure. And, a lot of questions have been asking, what does the whole pandemic means to? And I just want to read something that's coming out from WHO Twitter. Describing the situation as a pandemic does not change WHO's assessment of the threat. It doesn't change what WHO is doing, doesn't change what countries are doing. So we're just vamping up all the things that we are doing. So we have already prepared countries, we have already told them how to move from preparedness to response, so they now just need to get more into that phase. And it goes on to say, even though countries with community transmission or large clusters can turn the tides on coronavirus, several countries have demonstrated that the virus can be suppressed and controlled. So, all countries must strike a fine balance between protecting health, minimizing social and economic disruptions, and respecting human rights. So it's important that we keep sending that positive type messages out.
Okay. One of the questions I want to ask is, they keep talking about just those who are sick to wear the mask. But if we're being told that transmission happens with the droplets, and when people are speaking, as I put on Facebook, up in your brain, you know, you're so exposed. Why isn't it that the message is going out that everybody who is so concerned should wear the mask to protect themselves?
Thank you. We are not encouraging everybody to wear the mask, and there is a simple reason for this. The masks are not effective if you are healthy. The use of masks should be reserved for people who are having symptoms, and there's a reason for that. The person with symptoms has the greatest risk of infecting other people. So it's better to contain the disease where it is coming from than for you to wear the mask if you are not having symptoms. Because you can pick up the virus from so many different sources. So it's better to stop an infected person from infecting everyone than to stop you who are not infected from picking it up. I don't know if that makes sense. It's better we shut it down so nobody gets it from where it's coming from than we all trying to protect ourselves from everybody who is spreading it. It's easier. But there's a reason for that though. Just wearing the mask if you're not coughing and sneezing. Number one, it's uncomfortable. Your breathing, your saliva can get the mask wet, and that will put you more at risk. The person who is coughing and sneezing has more value in using that mask because you are containing that infectious material from spreading into the environment. And that is the benefit of giving the mask to the person who is ill and not to the person who is well. There are a few conditions under which we encourage well people to wear a mask. If you are a healthcare worker looking after an infected person, if you're in a frontline situation, if you are coming in direct contact with somebody who is coughing and sneezing, then you use it as protection. But there would be no value for all of us in this room to put on a mask now. Yes. Yes.
So Wesley has a question, and we have a couple of questions in-house, and I also want to start to incorporate some of the questions from online.
Dr. Fletcher-Larty, the reason I raised it is I'm a dialysis patient. I am constantly around people who are coughing and sneezing, you know, and I've seen nurses coughing and sneezing, patients, and sometimes they'd give them the mask and they won't wear it. You see nurses not washing their hands, and then I get a bad rep for just not working with most of them. And I get a bad rep for being snobbish because I avoid the patients and I'd step outside. Because even though there are protocols in place, people don't follow them.
Yeah, coming back again to the lessons learned HIV and AIDS, when it was declared a pandemic as opposed to an epidemic, it served as a kind of trigger for panic in some quarters. And I think that what the authorities needed to do was to give the assurance that the protocols for care and prevention and so on remain the same. It's the same practices that you would be applying for at this stage, at the outbreak stage, at the epidemic stage, that now apply to a pandemic. The pandemic suggests that there would be a change of protocols at the global level with respect to countries dealing with each other, and in some instances internally. For example, when the question of the broadcast quota by the state, the mandatory this is a perfect example of what such a provision is there for. But instead, there's been this practice of using it for political propaganda, and it has been watered, and it has lost its value, and has become one of the most unattractive things in broadcast media. So it would have had far more sting if this is what those spaces in the broadcasters were allowed for.
Sure. Quick.
Can the germ survive in water, swimming pool, in the sea, etc.?
I don't have any information on that right now. but we can find that out and get information out. Yes?
The virus is pretty new. So like we have some other viruses like norovirus. We know it can survive for long periods. But this one, I mean, a lot of research has been done, and we don't want to, I mean, there are questions if it can stay on surfaces, there are questions if it can stay on pool, there are lots of questions, and we don't want to actually put that out or speculate unless we have definite confirmed scientific evidence. Yeah. Still, we don't know.
All right, a question from Stacy.
No, I just wanted to get some clarification in terms of the declaration of a pandemic. Right. And you said earlier, Dr. Indar, that it allows you to free up more resources. So can you go into a little bit more detail in terms of what resources you had available, what more resources it's going to free up compared to what you had before?
Okay, so
Sorry,
countries
let me just add to that as well. You also mentioned the political resources that come out. So don't just limit it to, I guess, general health-related resources, but as well as the political and legal resources that we mentioned earlier. Thanks.
So every country and agency tends to have something called emergency funds, or funds to deal with the emergency. Sometimes it's there, but sometimes it's not really there to actually take, but this allows you to then use those funds or to have those funds materialize. So we would then need to do more things, like revamp up our communication messages, making sure countries are more prepared. You know, I've just been asked for a hotel preparedness guideline, things like that. So getting the human and the technical and other resources we would need at CARPHA, we would then have that information. We do lab testing, transport, and all that. We would need more money then to be able to do that. So this allows that. And a country now, that will allow them having that more availability of funds then, or more ready availability of emergency funds, then they would be able to do, probably put more frontline workers, ports of entry, establish, to have more persons to be able to use to implement their protocols of response and so on. So it goes like that, having that more readily funds then, that you can, having funds that you can more easily now access.
Can I just add something to that, Dr. Indar? So at a country level, most governments would have what you call a contingency fund. And this fund cannot be spent for anything except like a disaster. And an epidemic would fall under the category of a disaster. So the declaring of a pandemic would give the government a legitimate reason to be able to use that fund for any kind of frontline issue, whether if they need to build like an emergency hospital overnight or to bring in external staff to ramp up their capacity, they would be able to justify the use of that fund under that. And other funds, for example, from an international perspective, the World Health Organization and its partners would be able, so if you notice a couple of weeks ago after they declared this as a public health emergency of international importance, countries were starting to send money. Donors were saying, take 50,000 patients would have that they can
prioritize two of them. Does CARPHA have the capacity to manage a large volume of cases for testing should that become the situation, and what would be the anticipated turnaround time along with managing the quantity? So managing the quantity and yet getting the results out in a reasonable time frame.
Okay, so the short answer to one is yes, because it's a PCR method. You can do 35 tests at one time, and we do have the median supplies available, so we have actually stockpiled. Turnaround time depends on many things. Thanks to the government of Trinidad and Tobago, we have a very smooth flow of samples getting to us. Some countries are also sending their samples through the regional security airplanes, so it's coming very quickly. Our turnaround time, once it gets to CARPHA, has been 4 hours, but it has to come to CARPHA once it gets there.
Briefly, can you explain what the test involves and what's different between the screening level and the confirmation level?
Okay, so COVID-19 is a type of coronavirus. So the first thing is that you want to test if it's a coronavirus, and if it's negative, then you do obviously go on. If it's positive, then you go on to see if it's COVID-19.
Okay, all Does CARPHA have a sense of whether or not medical staff in the region are properly supplied with N95 masks and hazmat suits to prevent contagion among medical staff and then, of course, transmission to other patients?
No, we are not fully aware. We are doing surveys, so PAHO and CARPHA have sent out country surveys to assess their capacity. So that's trickling in, and we hope to have more information for that in the future.
Right. And last one, someone's asking if sporting events are considered non-essential.
I don't want to contradict and say you should stop your events, but I think it has to be a call. So for instance, we made a call 2 weeks ago where we had to postpone a big event because people were coming from countries where there was sustained transmission. So you have to take these factors into consideration. Like for instance, last night, the US would have canceled 2 major musical festivals because where people were coming from. So if there's a risk, then that has to be taken into consideration before cancellation.
Okay, let me thank the panel and hand it back over to Ms. Curtin.
Okay. And just to add, so as more tests come, obviously we would lengthen that. But right now it's 4 hours because it's few tests, but as it comes, it may be within 24 hours. But we have given that guarantee 24 and most 48 hours.
Okay, thank you.
Thank you so much. We have come to the end of the media briefing. I am really pleased at the way this developed. Thank you for your participation, and we look forward to your continued assistance and support in terms of disseminating not only timely and reliable, but accurate information about COVID-19. If you have any follow-up questions, queries, concerns, I just want to let the persons on our live stream, both on Facebook and YouTube, know that you can in fact send. We are going to respond to those that we have seen on Facebook and YouTube. We are going to respond to them after the meeting, and also to ask if you have any other queries and concerns, you may in fact contact us at comms, COMMS-team @carpha.org. I hope that I'm inviting you to lunch now, and I hope that that you don't encroach upon our presenters and the staff in terms of their time. Allow them to have lunch, but please, we want to thank you again, and feel free to send us any of your requests and concerns via the email address that I just gave you. Thank you so much. It has been a pleasure.